All right, hey, let's call to order our work session for the Board of Supervisors. Today is Thursday, August 14th. We're meeting in the hearing room on Melody Lane in Building G in Bisbee. The order or deletion of any item on this agenda is subject to modification at the meeting, and any item listed is open for discussion. Please note that some attachments may be updated after the agenda is published, meaning presentation materials displayed at the board meeting may differ slightly from those attached versions. Members of the board may attend either in person or via Microsoft Teams. Members of the public may also attend this meeting via Microsoft Teams or the mobile app. Work sessions are a time for county staff to inform and discuss agenda items with the board of supervisors, and public comments will not be taken. We'll begin with a roll call. District 1.
Crosby is here.
District 2.
Gomez is here.
And District 3. Anthony is here. All supervisors are present and in person. Let me go to Sharon first. Ms. Gilman. While we're here, I believe this is a result of an agenda item
Sure.
from
So
Mr. Crosby.
when we met to approve the final budget in July,
Right.
Supervisor Crosby brought up a question regarding the health department budget and the growth of that health department budget compared to inflation. And the board asked for more information about the health department budget and how it has changed or grown over the years, particularly related to COVID funding. So I asked Barb, and Barb Wang is our health director. She's here to present, and she's also got her finance.
Hang on a second. Did you want to clarify any of the questions you
No,
had?
I just want to cut your budget.
Okay.
Pretty simple because there are so many other considerations like PSPRS, which we're starting out in the whole $36 million, as I recall, isn't that about right? And we're still waiting on some of those city reports like Sierra Vista's, which was about the same, or is about 40 million. Do you have any idea what theirs is?
No.
Okay, so the county's starting out with 36 million in the hole, even though it isn't a loan and there's no interest on it, fortunately. And pondering, well, it looks like we are, the voters will decide if we get further into debt to the tune of $100 million or something like that about the jail tax. So it is important, in my opinion, to keep taxes low.
All right.
I would just like to say, though, after now serving on the health department and I don't know, the director, whatever I am, but listening to all the things that you guys do, I really don't think the Board of Supervisors understands. For instance, I went to a restaurant with the mayor. He got violently sick. I called you up, and there were so many violations that it was amazing. And then what you do, even with the screw worm, you do so many things that I was not aware of. And I think that it's good to talk about all that the Department of Health does.
I'm not saying that the health department doesn't do a lot. I'm saying that money is the vector. Money is a vector.
I do see a lot of stuff going out on Facebook and all these things going on, and I kind of wonder if we're crossing the line of, is this a role or not a role of government line? So I do have concerns like Mr. Crosby does too. It's kind of, I don't want to say all the fluffy, touchy, squeezy.
It's socialist medicine.
Yeah, stuff
It is.
like that,
It's
right?
research.
So, you know, the role of government is to protect individual liberty. It's not to provide jobs. It's not to provide events for social gatherings. It's not to provide, that's not really, in my opinion, that's not the role of government. So when I see a lot of these things on Facebook and other social media about, oh, this event, we're sponsoring this event, we're sponsoring this event, and I see Cochise County Health Department, I kind of go, is this going beyond the role and function of government? So that's something.
And I think that's what's really imperative is that I need you two guys to be on board with the port of entry, because the only way we're going to be able to lower taxes and provide services is to have economic development. And we're at a precipice right now where it's got to, we've got to be proactive on it. The county has already spent $10 million on this port of entry since 2020. And, we've got to make sure we get our money back and get economic development going so we don't depend on the Department of Health to do things that need to get done.
All right. I mean,
I
think we're on board with, I'm at least on board with your port of entry. I don't know where you get the idea.
We need to, but we'll talk about it later.
Okay.
A further comment.
Okay, go ahead.
I attended Sierra Vista's breakfast yesterday.
Oh.
And they wanted to talk about how they were given so much money to a charity. They were supporting a charity with hundreds of thousands of dollars. And so the immediate thought that goes through my mind is it up to the government to donate to charities, or is the government being a charity? Or are you preventing people from, by taxing them, you're taking away their money, which they would otherwise have the choice to put into whatever charity they wanted if it wasn't being confiscated by the government?
Well, I mean, confiscated is a tough of a word, but I mean, and when you talk about it though, you know,
If you don't give it to them, they throw you in jail. So, I mean, that's pretty close to confiscation.
yeah, but I mean, at the same point, when you let a area, like you always talk about how much you support Douglas, I've asked them to do all the amount of money and the people go to Sierra Vista for movies, for food, for everything else, plus Alpharetta. You know, and the reason they're going to Sierra Vista is because there's nothing in Douglas. So anyway,
No, I got it. Let's go to,
Thank you for the opportunity to talk through the budget and address some of the questions Supervisor Crosby had. So good morning, Chairman Antonori, Supervisor Crosby, Supervisor Gomez. This is specific to the Health Department and it shows a 5-year span. So as we begin. All right, so as we talked about initially at the first budget meeting, there's a pretty equal split between grants and general funds. It's nearly 50%. So when you look at 2021 to 2026, you do see slight increases over time that are really attributed to inflation, that market that we receive. So each year you're going to see that lift. You see a larger lift during COVID in the grants. And then when you look at this year, you see it drop significantly. And we'll talk more about COVID, the money we receive, how they're related to the positions, et cetera. But when you look at that final number for the increase, that 1.2 million, keep your eye on that number because we're really going to focus on that.
Where is that? I'm looking for it. 1.2 million.
Yeah, the 5 general
okay.
funding.
just the increase on the blue line.
You got it.
Yeah.
That's right. Okay. So this is that 5-year, this is the organic growth. So this is the things that the health department doesn't have any influence in. That salary adjustment, the market sum that we receive, and also fleet. So these are monies that we get that we do not have any say in for the most part. They come to us. So if you look at FY21 all the way down to FY26, you do see that 1 million. The difference being 422,000. And so on the next slide, it's all going to connect. So if we look at the percentage increase over the years, it comes to 21%. However, when you deduce the difference from that organic growth, the market and fleet, over 5 years, it's only a 9% increase. That's pretty darn good for such a large department. So you're not talking about a ton of money here. It's a very slim margin.
You're talking cost growth, though. You're not talking the overall, you're just talking over time, that growth. And I don't know if that's just, I don't know, I'll defer to Mr. Crosby. I don't think he was talking completely about just the growth aspect. He's thinking about the totality of, we're spending roughly, was it $4 million? Is that what it is?
So what we're taking a look at here, sir, it's we went pre-COVID. So I started FY21 because COVID started between year 2020 and year 2021. That's when it started going up. And that's when our grants for COVID started appearing. Okay, so if we start in FY21 as the base, this is why up on the top one, you're going to see that there is no organic or growth. This is the base. If we start there, since throughout the entirety of COVID and now after COVID, our budget has increased $1.2 million. Now, taking out of that the things that we have no control, which is organic. Now, this is where we look. If you take a look at the percentage all the way on the left, the CPI, this is the Consumer product index. This is the cumulative percentage for the past 5 years, 21.85. That is all of the United States.
I understand.
Okay. Now, and this is, understand, this is not for us. This is coming from the Bureau of Labor Statistics. Okay. Now, I compare that to just the growth, the 1.2 million. So what would be if I just take a look at $1.2 million and say how much have our general funds gone up in that same amount of time? So that's where you see that 25.61%. However, I personally would argue the fact that the organic growth should not be taken or put against us because we don't have control over that.
So I get it. You got salary bumps based on the generic countywide allotment for.
Yes, sir.
And lead.
So how much of that is actually just increasing the number of current personnel in department, and how much of that is paying for additional people that stayed on after or were added after?
I'm going to go next slide. Okay.
Oh, okay.
So there were 2 positions that were paid for during COVID, and those 2 positions are gone. The money's gone, the positions are gone. One
You
ended
only
in
put 2 people on during COVID
Yes.
on the county payroll?
They were paid for through grants.
The last
And
budget.
so you didn't put anybody else on
That is
During-
correct.
during that
That's
time?
accurate. Yes.
No other hires?
Yes, sir. That is correct.
So 2 million or whatever, that was immunization, vaccines, education, and the staff
That's our whole budget
for COVID, for everything.
for everything.
With COVID.
Yeah. Before and after COVID. So we had no additional, we have no additional. This is it.
So now you have the same number of personnel that you did in 2021.
That's correct.
I see.
And how many is that?
88 or 87. It's either 87 or 88 folks.
The only FTE that I can think of that would be approved in that time was that.
Was Rafa,
Mhm.
yeah. And he was working for us.
Mhm.
Yeah, nothing additional. Any other questions or concerns that we can answer?
Anyone? Huh?
No, I still want to cut the budget.
Understood. Duly noted.
I know did Joe talk to you about the constituent issue that I had?
I modified the way it was written
Okay.
to make it clear.
I haven't had a chance to go back, and I know he
Yeah,
emailed me.
I changed
didn't-
it just so it was clearer.
What are you talking about? Sure.
I have a diabetic in my district that had compiled a bunch of, insulin needles because she takes insulin. And I guess she went to the Benson Hospital to turn them in. The Benson Hospital turned her away and said that they don't take the sharps and to call the health department. So I guess she drove down the street a half a block to our county building in Benson, and she went in that building there, and she went to drop them off there, and the lady there said that they don't just take them; they charge $5 to drop off there.
To the county?
Yeah, to the
The
county.
county charges $5?
Yes, however, if someone is unable to provide that cost, we do it free of charge.
I talked to Fazio too. And Fazio said that he's prohibited by law from taking biological waste.
We take it. People come in routinely.
Yeah, so it just, what is your collection facility that collects all this while people come in and they drop it all off? What is the concern I have is I'm thinking of Fazio's guys, right? The garbage sanitation guys handling garbage that people who don't want to pay the $5 throw their stuff in the garbage.
We rarely have people pay the $5. Most people do it free of charge.
It's also.
Then why even have it then if you're?
It pays the cost. It's part of ADEQ. It's on the ADEQ website. The health departments will charge $5, but if they can't afford it, they can do it free of charge. There are people that come in that do pay $5 that feel it's important. That money goes to Stericycle to dispose. It costs us much more to dispose of all of that than it.
I mean, we put a hospital banner and here and it's surprising how much that costs to get rid of those Sharpies.
Which is probably why the Benson Hospital won't just take shots
Yeah.
from
But
everybody.
happy
There may
to
be
take-
liability stuff there too.
And I reworded it. I sent it to Mr. Casey, but I can send it to you directly to read.
That's fine. I have it. I just haven't read it.
Okay.
But I saw his email. He sent it like 4 or 5 o'clock or something. I was out with Ms. Gilman yesterday, out at the racetrack.
Oh, that was nice.
There was. You should have seen Sharon in her helmet and, doing 140 down the back straight in the Porsche. Yes, she wasn't driving, but I'm thinking, is it $5 really a big deal when it comes to, I remember, when I lived in Pima County, they had this charge it was quite excessive, for people dumping certain things off at the garbage dump or ours is cheap. It's like $7 to go to the.
By weight.
Oh, no, it's $7 per truckload or by weight after that. If you got more than a truckload, they charge by the Pima County was charging a whole bunch of money. What happened was everybody would just drive down a dirt road and dump their garbage.
They still do.
Yeah, I mean, because it was just so I keep thinking of, okay, $5 for somebody to drop off a little red box. It's like this big and it's per container, right? It's not just.
Yeah.
No, yes.
Yeah, we charge $5, period.
Okay.
Yeah. So we do disposal of EpiPens, we do needles, and then we have a lot of community agencies come in that bring larger amounts of needles when they do cleanup at parks and things of that nature, and they pay. Their organizations, yes. Yes, in fact, Cochise Harm Reduction brought us 2,400 needles.
And then you guys do immunizations too, right? So you're
Correct.
creating sharps and biowaste
Correct.
as well. And that comes out of a budget anyway to cover that.
Correct.
All right. Here's the email. That's all I got.
Okay. Well, it's just like what I was saying about the flood control district. If we took 2.6 million away from flood control, they were still going to have 7 million. And so whatever I was saying we should take out of the health department, they're still going to have millions.
Well, I just got to also think when you sit there and talk about cut. I understand. But you got to talk about how you're going to produce an economy. And there just isn't one. When I go to Thatcher and I went to Safford, that place is booming because of the mines, okay? And they're bringing a lot of stuff down to there. Cochise County, we don't even have an economic development plan for our county. I don't know when the last one was. It's great to cut, but it's also part of a responsibility. How are we going to provide jobs? Because I'm telling you, you're going to cut and cut.
Right.
You're not going to have services for the people who are retiring, the aging, the old.
100% with you.
So
The way you do it though is you create the conditions. The government is supposed to create the conditions, not.
So we need to look at economic zones.
Right.
And we need to do that. So as we're cutting economic opportunity zones, in fact, in the so-called big, beautiful budget or bill, there's supposed to be a whole bunch of opportunity zones for rural.
There's
America.
incentives.
That's what I have to look in and find out.
There's incentives.
There's incentives.
What's
and
the incentive? That's what I'm getting
No,
at.
incentives is tax breaks.
Okay.
Okay,
So what happened, that's what I want is tax break. So I'm doing
So
the same.
for the companies, right, that are going to come here to employ. So at the same time that you're giving these opportunities, people are coming and producing something. We're not producing anything as a county. We're not creating jobs. We're not creating an environment.
We create the conditions.
Yes, but how are we creating the
By
conditions?
keeping
By
taxes
cutting the taxes of
That's
individuals.
right. Well, like yesterday, right, Ms. Gilman? Yesterday, the gentleman who was out there, what did he bring up? He
he would like to have additional housing and development in the area.
But he brought up the sales
The
tax
sales tax.
overall in Wilcox being very, very high, right? And he says it is a major inhibitor of businesses coming in when the
Well,
retail
the
sales
water
tax.
is something.
Well, water was the other one.
The
He had
water.
two issues. One was the sales tax rate and the other one was the water. But sales tax is a problem, but what we're doing is, and this is to your point, as well as Mr. Crosby's, the municipalities have nothing, like what's going on in Benson, for example, right? They have nothing to build a tax base on. So where do? They go to retail sales tax. They go to food tax because that's where they get their revenue from. Like Wilcox, all they got is the Safeway, Benson, Safeway, and Walmart. That's really their retail drivers. They got very little from the property tax. They get very little from the economic growth where people come in, they get a job, and then they buy a house, and then they shop. That's not happening, right? So you're right.
For Douglas, 70% of the sales tax comes from Alpharetta. Doesn't come from Douglas. So, when you're looking at Douglas, which is 32, is the median age, we got to keep these kids there because that's where you're going to be able to produce growth, produce people who are going to want to spend. People are coming. We have a high school reunion. 3 people want to move back to Douglas because they're tired. So I got you. I understand.
But
When we talk about cut, I just want to understand what are we doing then? Besides just cutting taxes, we have to provide conditions because cutting taxes on people who are retired. We're cutting on taxes who are people who come here and buy, this is like their 3rd or 4th home. But we're not creating conditions that improve economic development. And when you look at Sierra Vista, look at all the stuff that they're doing. Where else are we doing any of that? It has a pool, I understand, the talent of people who can do this stuff, but we have to be looking at Noble County, a pool of people, okay? And so we have to be spreading that kind of, instead of just being in Sierra Vista, it has to be spread throughout the county. So then the next thing is we're going to cut, then how are we going to make growth? And it's not just on cutting people's, property taxes. It's about creating economic conditions for people to move here. And the municipalities, we can't.
Oh, yeah,
That's
we can help a lot. As you know, you do a lot for Douglas, right? You can do a lot, like Benson, and like we were out in Wilcox yesterday, right? Talking to folks out there about economic development, trying to get stuff going out there. We've got factors, though, that inhibit that. One is, and I had this issue with trying to get Sam's Club to come toward Benson, right? The guys at Walmart basically said, we are not going to put a Sam's Club in Benson because the retail sales tax is 9.8%. When we could go to Vail, right down the road, out in Pima County, right at the edge of Tucson, and do it for 6.8 or whatever it is there, 6.5, right? It was a black and white prohibition from them to come into Benson because they will not put it there because
And this is the balance that you have to figure out, right? Because that's great. This is a balance you have to figure out because Benson is a little bit different than you got McNeil and Double Adobe and Nackle and Perryville where there's nothing, right? So there's nobody's going to be drawn to them because you're not creating an opportunity zone for manufacturing stuff to occur there. You're cutting property taxes by 2%. That's not going to create the growth, I think, that we need. So what happens is you have these areas of poverty that you still, as a government, have a responsibility to. So that's what I'm just saying is this is a real challenge as far as when you're for a county with aging population and, yet you want to create more jobs and have more taxes come in so that you can do the things you need to do, like county roads. So anyway, that's
tax-based lows, broadly spread. That's the goal, right? Mr. Crosby. Yeah.
With regard to tax incentive for businesses, there is no tax cut without a concomitant budget cut. Just a tax shift.
Yeah.
So if you are going to let the businesses not pay the taxes without making a budget cut, somebody else is going to pay the taxes that they would otherwise pay, and that's going to be the middle class. And so what you're doing is all of a sudden you're tending towards making your middle class into lower income by taxing that direction.
So you don't believe in any kind of opportunity zones or economic zones from light manufacturing?
Well, I said, there is no tax cut without a concomitant budget cut. It's just a tax shift.
So then why don't you look, like when I'm looking at Douglas to build a hospital, I'm not looking for the government to do it or the county to do it. I'm looking for the businesses that are coming in to, and talking to them and saying, hey, because what, to draw people to Douglas Hospital and schools. Can't necessarily do anything about schools, but if these companies who are going to make a lot of money and with the drone program, why can't they contribute to the hospital?
Yeah, let me bring it back to this because we're starting to drift
Yes.
into
Go ahead.
we should probably do a work session on economic development.
Yes.
Pretty
Yes.
soon, right? Back to Ms. Lang and her crew.
And I do know she has some updates she wants to share with the board as well on things that are upcoming for the health department so that you can see them and understand what you're seeing.
And my philosophy, I know Mr. Crosby is very blunt and direct. I'm kind of blunt and direct. I have a heartburn, and I've always had a heartburn with subsidizing people that make bad life decisions and putting the onus on people that make good life decisions to pay for those stupid decisions. I cannot stand subsidizing stupid is my, I guess the word it goes. So that's the concern. I don't mind the safety net and the social safety. I believe government has a role there to protect people who, through no fault of their own, whether it's an economic circumstance where they were born into and they're trying to get out of it, or people that have a tragic event in their life or something, or they lose their job or something like that. And then we provide temporary safety net and then provide the conditions for them as soon as possible to get out of that condition. I don't like coddling and keeping people in that position for a long period of time. And I think we're starting to see some of that now at the federal government that's going to incentivize particularly men who are sitting in their mother's basements on Facebook all day collecting welfare and SNAP payments. That's starting to go away. And I hope that they continue to start expanding that because I saw a lot of this when we were in the legislature. SNAP abuse is a huge problem. I had videos from Circle K clerks showing people coming in with a SNAP card buying like Franks and beans in a can and a few other things in a can. And then after they pay for that with their SNAP card, pull out money and buy 2 cartons of cigarettes and these little cinnamon fireball liquors as they walk out the door with my money.
This is a good segue.
Right. So that was always my biggest heartburn to see people who think that SNAP becomes a disposable income source for them to buy more booze and liquor, right? Because now they don't have to pay for food now because they got SNAP, right? So to me, it was a huge problem I had. And I wanted to, as you can go look it up. I wanted to drug and alcohol test everybody on SNAP. And if you had nicotine in your system or you had alcohol in your system, you lose your SNAP card. Antonori is the meanest guy in the world. It's like, I don't like subsidizing you with my money. I'm sorry. That was always.
Or food stamps being used in McDonald's. I mean, that's not what.
Well, yeah. Well, that's part of the new reform that's going through. They're screaming about it. If you watch the TikTok videos, it's hilarious. If you
can't buy their Big Mac.
They're all crying because I can't buy this with my SNAP card now. I can't buy. They won't let me buy this. With their giant super Slurpee, at the whatever 7-Eleven. So I mean that was always a pet peeve. So when with your department, unfortunately, again that's Antonorism number 27. Antonorism number 1 was I couldn't bring my gun into the building over in Benson. I had a heartburn about that. That's a whole other story.
This is a good segue, but I know.
But that's my thing. So it may not necessarily be, and I get where you're coming around. You just got cost growth related to inflation, and
Yeah.
I get it. And you're maintaining the same number of employees. We give you a salary increase that's blanket applied. It's going to bump your budget.
Correct.
I got it. But there are things that I think if we were to do a deeper dive, there may be some programs and stuff that you're doing that may have a lot of people who are funded to go do those programs that I don't know, Mr. Crosby or Ms. Gomez she may not think they're unnecessary. I may think they are unnecessary and we should eliminate them and vice versa. But that discussion can come at a later time. That involves a deeper dive into her.
And I think a better understanding of what they do and the outcomes.
Right. But that would be a program by program review of all the different programs that the health department does and having a discussion on the budget related to those programs. That's probably a discussion that we probably aren't going to do until next year.
Just like agriculture, the things that you're doing with the agriculture,
Yeah,
I was
talk about
surprised.
Yeah, I'll talk about that.
Yeah.
Yeah, but that's probably,
One of the things that I think is an important consideration is anything that we do that's statutorily required is paid out of the general fund. Those other things that, you
Or
refer
grants.
to as more social
Yeah.
are grants. Correct. So that would be, it's not.
that makes
money-
me feel a little better.
Yeah, it's not
But
money
it's still
coming out.
tax dollars coming from somewhere, and then I could go have a discussion with those individuals,
Yeah.
the legislature.
But it is
or-
creating jobs in the county, those
What do you mean?
services. Well, those grants are paying for those positions. Those people live in Cochise County.
Or are you talking about the government employees?
Yes.
Yes, sir.
I'm afraid that is another fallacy that the government creates jobs because they don't.
Yeah, I'm not a big
For every,
fan.
for every job the government creates, that money's got to come from somewhere and it's coming out of private industry or
Yeah,
some
that's,
source.
that's,
Right.
Sorry about that. I wonder, how long would it take you to figure out what is Graham County's total budget this year? Can you just go lickety split and figure that out?
Graham counties?
They're
What?
like 9,000.
Yeah, there's nobody in that county.
Then you can figure out what's the population and what's the
And,
budget.
and if you go outside of Thatcher, Safford, there's like, yeah,
It's 1/3 Indian reservation or is it 2/3 Indian?
that's another problem they
Yeah.
have is they got a large, yeah,
Yeah.
yeah. And the mine,
The reason why I
Mine
mentioned
is
it
like-
is because
Those-
my dear
the nine
colleague
days,
mentioned
their budget.
Graham County.
Yeah, they-
Graham County, they're rocking.
Well, they have a mine. They have themselves, they have Freeport Macro.
that's their Fort Huachuca.
Yeah,
And they get government.
And they get a lot of, yes. And then they have the agricultural farming there, which is in kind of dire straits right now. But people are also moving there because of the climate. It's not that far away from,
I like it.
Tucson. I mean,
Yeah.
it was, I was standing with the chamber.
Our
of
goal-
commerce, loving it.
Our goal should be to create infrastructure
Yeah.
that will then facilitate industry and business coming in, because when they build buildings, Phil Weindecker goes out there and he says,
Access-
yeah, this is what your buildings are worth now. And that way there, we spread the burden throughout the tax base rather than when we don't have industry coming in and demand is going up and inflation is going up, then we have to find a way to cover that cost. And unfortunately, homeowners end up paying the brunt of that. So we should be focusing on doing everything we can to get business in here and helping to mitigate the opposition from, as I affectionately call them, cave people, the Committee Against Virtually Everything, that seems to come out of the woodwork every time we try to bring industry into the county. Yeah, and they find a reason. It's always, oh, we don't have any water. Oh, it's going to.
But they're retired.
Yeah, they're almost all retired. They've made their money somewhere else. They moved in here.
For 5 or 10 years.
Right.
I think they want.
And then they basically don't want anybody 35 to 55, which is the magic number for generating growth and revenue, is the 25 to 55-year-old. Econ 101, right? So that's where we're at. But let's get back
Okay,
to Ms. Lang.
You guys back again.
Yeah, we got to bring back.
I think there's really some important information that I need.
Okay, go
in
ahead.
order to have a-
Yeah. Let her put out her what she wants to talk about. But go ahead.
All right, thank you.
Need to have
So
enough
some of the
time.
things we're doing, Supervisor Gomez mentioned agriculture. So one of the things the department is doing is we have gotten into a collaboration with the University of Arizona and the McNeil Co-op. So these are local farmers out of McNeil that grow fruits and vegetables. I've connected with Jackie Clay, who involve, we're starting with snacks. So carrot sticks and cucumbers, fresh apples in children's lunches so that kids are eating healthy. Hopefully they'll talk to their parents about nutrition. I like the way this
Is
tastes.
this a grant that funds this?
It is a grant.
Okay.
And it's not through the health department. It is actually through the Department of Education. I saw the grant, brought the folks together. It's a wonderful opportunity for kids to eat healthy, hopefully move that into the families. Dr. Clay is in great support of it. So I'm doing a presentation with the McNeil Co-op. It helps the local farmers. They get paid. And so we're starting with snacks, then we're moving to salad bar, then we're moving to school lunches. So it'll be a gradual progression. Almost every school in the county has signed on to this program. They're very excited about it. They're tired of kids eating junk, for lack of a better word. And so this is a nice way to help see people get healthy, have nutrition, and really promote that energy so kids can do better on test scores. There's a lot of research surrounding that. Eating healthy linked to brain health.
And one of the things I campaigned on was food sustainability, local food sustainability, because if anything happens, we're screwed. So that is, you're working with the milk co-op.
Yes.
Is that the one that has the farmers market?
Yes, the mobile market, correct.
That
So the
goes around,
farmer,
right?
yes. So the farmers are very excited about it. Dr. Clay is very excited about it. The schools are looking forward to it. And so we feel like it's a win-win. One of the other things that I've been working on over the course of the year is I got a grant that the board had approved on keeping care local. Hospitals are a major market driver in this county. So the more people that get services and spend money in this county, the more we can look at infrastructure. So I contracted with a marketing firm to do keeping care local. It's the 5 hospitals, including the health department, to let folks know what the services are here, because a lot of people don't realize a lot of the specialty care, a lot of the medical services that are received here, they don't think exist, and they go outside of our county and spend money in Pima and Maricopa. I want to keep them here. I want the money to stay here, the jobs to stay here. So that marketing campaign is almost done. You'll see it on billboards, radio, and the tagline is "Health is here." And it's really to educate people. I applied for another grant that will have an accompanying database. Any resident, any person visiting Cochise County can look up a medical service in this database. It will have geo mapping, show them where it is in the county to get there, and then they can arrange
So like-
transportation.
So like what? If I want to like find a urologist?
Yes,
I could just
Yes.
go on this website
Yes.
and it'll tell me every urologist. in
that's
town?
exactly
How about the
right.
guys that come in from out of the county?
That's exactly
That'll
right.
be in
Anybody
it.
can utilize it. Yes.
No, what I'm getting at is, like for my cardiologist.
Mhm.
So I used to go to this guy all the time in Tucson and
Mhm.
all the way up at the far end, like
Mhm.
Campbell and
Right.
Sunset, right? Way the hell up there. And all of a sudden, I don't know why, TMC maybe or somebody
Mhm.
had him drive out to Benson 1 day a week. And he's like, Tuesdays, he's in Benson. The rest
Yes.
of the time he's in, so on Tuesday, he's in that little office there next to Tractor Supply.
It will show that.
So it'll show that guy.
That is
Even
correct.
though they're not like
Yeah,
residents.
that is
of the
correct.
town, or they
Yeah.
have a shingle
Yeah.
in the county.
And on the back end, I'll be able to collect data.
Where'd you get that data from?
When people do the clicks, when
No,
people go in.
like the doctors. How do you know?
It's
the-
listed in it.
Where do you get them?
I worked with them. So the marketing agency reached out to the physicians in the hospital and it's all been programmed in. I'm just waiting to see if I got the grant to pull the trigger.
Oh, okay.
And then, like, Douglas has a lot, like Hodges comes from Tucson.
So it's all over Cochise County.
Yeah.
Instagram.
Yes, sir.
Ms. Lane, which services are typically not available that people most typically go to Tucson for?
Rheumatologist.
Really?
Yes, there is no rheumatologist in Cochise County. We have a large amount of autoimmune diseases, Crohn's, Graves, rheumatoid arthritis, lupus. That's the service right there.
Why do people take helicopter rides to Tucson?
Yeah,
They're going to
it's
die.
Yeah,
You know?
exactly.
We're talking about
trauma hospital, trauma
Yes,
hospital.
that's what I'm talking about.
Correct.
Yeah.
Trauma. But rheumatologist is the #1 service that people say, because we did a community health needs assessment and that came up repeatedly.
You would think,
Rheumatologist.
you would think Banner or TMC or somebody would see that opportunity.
There is a shortage of rheumatologists in general. Even in Tucson, they have very long waiting lists. So there is no incentive for them to come
Yeah,
here.
I used to be in the medical kind of field,
Mhm.
you know, and yeah, that was not one of the sexy
Yeah.
medical fields to get
Well,
into.
there's a lot of autoimmune
Ortho was
diseases.
like everybody wanted to be an orthopedist because that was like the big money. Yeah, that's where the money is. And then the next one is like thoracic surgery, like heart surgeons open. That was like the next. Other than that, it was like rheumatology and like dermatology were like, ugh, nobody wanted those.
Rheumatology and trauma. Those are the two.
Trauma is
hit.
expensive.
Yeah, those are the two
And the
hits.
hospitals are required to invest significantly to have those services here. And that's why, what I remember the big fight over losing at the time, which was University of Arizona Medical Center being a level 1 trauma center. And that was, I don't know if you remember this, we took the hospital away from the university and we gave it, and we established a private board to salvage it and get it back up and running. And then after we got it back up and running, the college wanted it back because now it was making money again. But we didn't want to lose the level 1 trauma center because level 1 trauma centers require, to get certified as a level 1, you have to have all these doctors in the hospital. Yeah, you have the thoracic surgeon, neurosurgeon, all these guys have to be physically there. Whereas a level 2 is they can be on call
Yeah.
and they can come in from some, but level 1, you have to have all these doctors in the building so they can call the guy up and he comes straight down from upstairs to the emergency room and then they go up to the OR and they fix whoever comes in, all banged up. So it's very hard to keep, and we only have one. That's University of Arizona Medical Center. All of it. That's why they fly them there in the helicopter, because that's, if you're a level 1 trauma patient, guess where you're going? You're
Well, I
going.
know Banner in Phoenix is the number 5 in trauma
But
hospital.
yeah, it's a level 1.
It's
Yeah.
level 1, but it's number 5.
Elizabeth Nelson,
Yeah.
have you found out what the
Yes, sir.
budget per capita in Cochise versus Graham is?
Yes, sir.
Okay.
Graham County's is $3,285.15 per capita.
Say that
Ours, $3,285.15. Ours is $2,333.50.
Okay.
Yeah.
Okay, how about PSPRS for Sierra Vista and Fry Fire?
So while she does that, I will continue the reporting if that's okay.
No, good.
So that's coming to a close. Another couple weeks, that campaign will come to fruition, and then I'll know in a couple weeks whether I got the grant for that website, which will be, I think, a game changer.
And that's going to be
for
on
the
the
county.
health department's website?
Yes.
There'll be a link page?
Yes, absolutely.
Okay.
There'll be, if I get the grant for that website, there'll be QR codes on every advertisement that people can scan on their phone, and the website will come up. They can log on at the library, they can log on at schools, anywhere. It'll be available and free. So I'm excited about that. And Cochise County will be the first one ever in the country to have competitors come together to advertise, to really bring healthcare here for the people, which I'm very proud of.
How's
Because I
that?
believe in keeping the dollars here in our county.
I got you, but how's the competition going to work? I'm trying to gather how you're going to bring competitors in. So you're going to
Well, they are. They're all signed on to this advertising campaign, knowing that they compete with one another because they understand the importance of getting those patients to pay for services here, to keep the money here. It pains me when I hear people driving to Tucson when we have that service here. I want to keep the dollars here.
Okay.
I want to keep the workers here
I agree.
and the service.
That's smart.
So there's that program. The other thing we're doing is a justice court judge, a superior court judge, and the county attorney, Lori Zucco, all signed on to a program. We have a great many homeless in this area. So on October 9th, they're all going to come together. It's a justice care collective to look at waiving non-criminal warrants for the homeless. We're going to have counselors there. They're going to have medical exams. We're going to have peer supports for substance use to hopefully
So
get
most of
people
those non-criminal warrants are
just trespassing in public camping. And so those folks will have a fresh start. There'll be job employers there. There'll be people offering treatment with the idea that there's a lot of needles that are falling on the ground and around the county. We want to get people into treatment. We want them to be productive citizens, get jobs. So it's a one-day event. And the courts feel like it's really clogging their calendar as
Yeah.
well. These are things that they want to be focusing on people who have engaged in felonies. They want their time to be spent on those people that, need to be in court. Another thing, we talked about SNAP. That program has been disbanded. That program was managed through the U of A, not the health department. All of those employees have been let go. That has been an advantage for us. We have filled some vacancies with some very qualified folks from that program. One will be out of the Douglas Clinic, one will be out of the Bisbee Clinic, and the other person will be in the Sierra Vista Clinic. One of the other things we've done is WIC. We are spending, Canyon Vista is a hospital that does baby delivery. There are a lot of mothers that are delivering babies that are, applicable for WIC. So we are going to Canyon Vista 2 days a week and enrolling people in WIC rather than having them struggle to get to one of the clinics to enroll.
How long is, I'm rusty on this because
That's okay.
this was 35 years ago when
Yeah.
my kids were born. So how long is a expected and then subsequently active new mother in the hospital after it's like only 2 days?
Yeah,
right? A
yeah,
day
it's
or two?
fast, yeah.
All right, but you're in there 2 days a week. So if they come in, they deliver on Saturday night, they're probably out Sunday
Yeah.
or
Yeah.
afternoon or Monday
Yeah.
morning.
So the hospital contacts us, they gather a group of people that are expectant and qualified, we go there.
Okay.
Yep. So we have that.
That's a decent program. Again,
Yeah.
that's a,
It's
has-
worked out for.
well, everybody knows, again, my previous health, the first 2 years of life, if you don't get a certain level of nutrition, it sort of puts you in a
Yes.
huge mental deficit where you see IQs and aptitudes and everything drop in kids that didn't get good nutrition in the first 2 years of life. It really screws the kid down the road if he doesn't get that. So WIC is one of those good ideas. A lot of pork in it, but it's a good idea. So maybe the pork is worth but
I agree, Mr. Antonori, that newborns are the second most vulnerable population after unborn.
yeah, it's just getting little kids, the first 2 years is critical. So WIC's good program for that.
Yeah, another thing.
And the price of formula is like out of control. So help them with
Do it yourself.
that.
Yeah. So emergency preparedness, as you know, a lot of fires in Cochise County, monsoons, flooded roads. So we do have a daily reporting center in the public health building here in Bisbee. We work closely with emergency management. It has computers in it. It has prompters. If we ever had to do any kind of public service announcement, we have a space. Any of the supervisors could address the media there. All of that has been built and paid for.
And that's under you?
Yes, that is correct.
Why is it under?
Emergency management isn't, emergency preparedness is. So we work in concert with emergency management.
Why wouldn't the same guy?
Aspect of emergency.
Oh, from the
Yeah,
public health aspect.
That brings up a good,
so air quality.
which is
Mhm.
overlap versus lines of demarcation. I
Mm.
prefer generally lines of demarcation
Mhm.
because when you start pooling money to run some entity, it's very difficult to tell where it came from. And then after it's spent, it's even more difficult to tell where.
There's no pooling. We're just working with them in concert.
Okay.
But you're talking two different missions though, right?
Yeah.
So one is
Prevention
emergency,
leads into
this is
action.
year before, and then,
Mhm.
what's the guy's name?
Dan.
Dan is after, right?
Right. Well, in my viewpoint, it's a blurry line of demarcation.
Yeah, it is. That's why I asked that question, because it's like, well, I thought we had a guy that does,
Dan is two people.
yeah.
Yeah. so
All the more
we-
reason that maybe that person
And you
who's
have
over there, and
that-
then he has three and you have one less.
But I think that's the public health aspect of it. That's
What is the public health aspect there?
of the
Air quality. There's a lot of people in
I mean,
skilled
how do you
nursing
fix that?
homes
If
that
there's
we
a
have.
forest fire,
Well, we work with emergency management to have people abandoned. We call the hospitals to make sure they have the bed availability. Skilled nursing home has to have evacuation procedures that we review if in the event there was an emergency. So it's about that preparedness.
okay.
Public events, we make sure there's exits, if there's enough roads, if something were to transpire.
You do that too?
We do.
The county engineer doesn't do that?
A lot. you guys do.
We do a lot, yes.
Yeah.
We
the
do a
county-
lot.
from a special event.
Like my little special events, right? And we were having the issue with the ingress and egress and fire
Right, so-
access. Is that her
Public-
or is that Watkins?
That's from a
they look at the road itself. She looks at the number of people and the sewage and the
Egress.
for those people.
Are there medical personnel that need to be on site? How many, if in the event it was some sort of medical emergency? Yes, we look at that.
And then what, you provide that information to your planning
Through
and
the
zoning guys?
permit process.
Mm-hmm. Yes,
They check off as well on the permit. So if the permit goes from planning and zoning, environmental health, emergency management, every department and the board of supervisors, if it's a liquor situation, and maybe a liquor license needs to be handled. So there's different aspects on that permit.
In fact, I just generously gave some of my road mileage to my.
Ms. Gomez, yeah. Yeah, your district didn't have any. We were sitting in, when we had that briefing, I was like,
Which one?
in the briefing, they're showing you were like disadvantaged, let's just say,
Always.
on roads.
Always.
Yeah. Yeah, it was
Even
surprising.
New Mountains has been disadvantaged
Yeah.
for decades, so.
If you'd have built that jail in Tombstone, we would have been able to pay, we would have been able to pay Middle March Road. We would have paid four miles of Middle March. All those wonderful residents and constituents used would have had a nice paved road going. I know. Yeah, I'm just saying, just to say.
We just talked about the screwworm because I was shocked what you guys do. And that screwworm is going to be so critical to us being able to do anything in the cattle industry. So I didn't know what you did. Can you talk about that?
Yeah, so actually, USDA tracks the cattle coming in, and if in the event they are infected, they do a powder on their back. But we coordinate with USDA on a regular basis just to make sure that nobody is bringing things into the county that are infected that could affect people. So we send a lot of testing for different things, bugs, animals, to the state to ensure that there's nothing in our county that's going to infect individuals. And you'll see a lot of posting on Facebook about rabies and everything.
We were at the Cochise Graham Cattle Growers at Wilcox. They brought that up and they were talking about how they've got like 2 dedicated guys now.
Well, it's interesting because Santa Cruz, which is in Gallusport, doesn't have an what do you call that guy?
Oh, an epidemiologist, an epi.
And we do, which is really amazing.
Yeah.
Yeah.
Because that's crucial.
But is that our guy? It's the state's guy.
It's our guy.
It's our guy?
Yes,
Yeah.
correct.
And the traps that you're setting.
Yes.
The flies.
Yes.
Like that. That's
Yeah, so we have traps set for mosquitoes all over the county. People volunteer to have us put them in their yard, and we have our epi take them to the lab and test those, vector testing, to make sure dengue doesn't affect cattle, horses, people. West Nile virus, I'm sure you've heard a lot about that in the media. We test for that as well. And the good news is we haven't had any infected insects in the county. And I just got the report 2 days ago, so that's very current. We do that on a regular basis to make sure livestock are safe, people are safe, there's nothing floating around that's going to affect somebody. And so it really is about health and safety. The majority of the programs we have.
you have the sterile flies to deal with the screwworm because
Oh, you do that too?
We do. We work in concert with the USDA. We do a lot of
What
different
about the
things.
state aid guys? They were talking about, they did the sterile.
He was talking to Mary and I about putting the sterile fly factory, which I know we've been upsetting for people, but it actually went to Texas, but he was trying to get it for us.
Why would people be upset with that?
Oh, because nobody likes flies.
But it's inside the building.
But you gotta release them. There's nobody more flies and
They're sterile.
I don't know the same fly, is it?
Oh, well.
No. But anyway,
We're connected to a lot of different
I'm actually, this is pretty good for me to know what's.
Yeah, we're connected to a lot of different things. We do a lot of health and safety.
So you're kind of like, since we don't have a
We
county
are a
department
safety
of
net.
ag, we have, the health department handles a lot of the.
With
departments.
USDA. USDA does a very
You don't
good
do anything with the state?
We do work in concert with the state for some lab testing, if there are medications that we need in particular.
livestock.
Yeah, they assist us in those things. So
That's going to be key because that cattle pen that's right there, the Sonora cattle pen, where we're expecting to have a lot of cattle come from Sonora. It's just going to be, and that we have this guy is unbelievable.
it is very nice that we have an epidemiologist and he does a great job. Yes,
minutes.
sir.
We
I
got-
knew that.
What did you find out about the
Oh.
PSPRS for Sierra Vista and Prime Fire?
So for clarification, Sierra Vista Fire Department, you want like?
PD and fire.
Oh, okay. You gotta give the PD again. I've got Fry Fire. Fry Fire. Do you want to know the funded amount? Do you want to know the liability?
The unfunded liability.
So their unfunded liability for Fry Fire is 2.873835. And Sierra Vista Fire Department is 249,935.
Okay, that's unfunded liability?
Yep.
For fire?
Fry Fire is 2,873,835.
Okay.
On their
Sierra
PSRS.
Sierra Vista PD or fire?
Fire
Okay, ready.
is 249,930.
That's not bad.
Surprise.
Yeah.
And PD.
PD is 411,350.
I think that
Or
either.
859. Sorry.
Okay.
You'd send those out. And I don't have anything further to report.
Yeah, we need to wrap it up. We've got a regular meeting here.
Supervisor Gomez's suggestion and Director Lane's suggestion, we would like to schedule a quarterly work session with the health department to update you on their activities because they are so large and diverse. I think it could capture the information, and I agree with Supervisor Gomez that it capture the information best in a work session so you can all discuss it and to continue this education.
I need to get a better idea of what's general fund and what's grant, though. That's the other.
Sure. So we can talk about that in the next quarter. Keep chipping away at it.
All right.
Yeah. Thank you.
Then we
Sure.
probably need to start doing
Deep dive.
better deep dives
Yeah.
down the road. We didn't have much time. We're all getting our feet underneath us, so our budget cycle kind of
There's a lot
now we could start digging a little deeper, not just in the health department. I'm talking about the whole county.
Sewage treatment.
Oh yeah.
Okay, did we adjourn?
Let's adjourn. Thank you, Ms. Lang. And what was it again? I'm sorry. Raphael. Thank you for coming by. All right. We're adjourned.